In this video I'll show you the easy way to treat trigger points in your upper back. Now they can be a big cause of upper back pain and can be especially a problem if you sit at a desk all day or say work at some sort of production line. Now with the techniques I'll show you, there's no painful pressure or getting into awkward positions with balls, no needles, no lasers, and no forking out for ongoing appointments. It's something you can easily do yourself, and it's as effective, if not more so, than any of the professional therapies. Now the way we'll do it is with a vibration massager. Now I'll link all the technical stuff, but simply what you do is place the head of the vibration massager over the trigger point. Now the vibrations penetrate deep in your muscles, basically dissolving the trigger points. Now it works extraordinarily well. Now there's no pressure to cause pain or potential injury, and none of the risks you associate with needles. Now, what I'll do in this video is go over the basics you need to find the trigger points and do a really good job. Then go over specific muscles of your upper back. Also, as I said, that can be a big issue for people such as those who sit at a desk, so I'll give you some helpful prevention advice. Now first, how do you find the trigger points? Now the basic technique is to use the pads of your fingers and do a general examination. Then if you find an area that's a bit tender or tight, use the tips of one or two fingers to examine a bit deeper, looking for tight bands of muscle with tender lumps that shoot pain when you press on them. Now they're the trigger points. Now that said, it's nice to be able to find the trigger points and recheck and make sure they're better, but the reality is you don't even need to. Now, if you're using pressure or needles, you need to find the trigger point accurately. But with something like one of these, if the trigger point's anywhere near under the head, it'll get taken care of. Now, with that in mind, there's charts like these that show where the common trigger points are. You can just go over those, or you can just do the whole muscle and you're guaranteed to get them all. Easier still, once you've used the massage a few times, you'll be able to feel where the vibrations hit a trigger point. Now, what you can do then is systematically move the massager over the muscle, and if you feel the trigger point, stop the machine and let it take care of it. Now, let's look at how to use the machine. Now, as I said, you just hit the head of the machine over the trigger point and let the vibrations penetrate. Now, I'll show the basics here and link the full instructions and precautions. A standard disclaimer, this video is not specific advice, just general information to be discussed with your own healthcare professional. Now first, for hygiene and to avoid skin irritation, use the machine over cloth or clothing. Second, if you have the part you're massaging horizontal, you don't need to hold the weight of the machine, and the weight of the machine applies the pressure. And thirdly, have the muscle relaxed. Now the massage is supposed to relax the muscle, but it can't do that if you've got it tightened. Now that's one of the reasons why results from using foam rollers are so poor. Now when people use them, they're often tightening the muscle they're trying to massage. Now lastly, you sit the machine on and let the vibrations soak in for 30 to 60 seconds. Now there's no need to do any of the conventional stuff like pressing in or moving the machine around. In fact, that can be counterproductive. Obviously if you move the machine around, you're not letting the vibrations soak in properly. Now next, we'll look at the machines that you need to use and the settings and the heads. Now, to get the proper therapeutic vibrations, you need a genuine vibration massager, not a massage gun. Now, they don't deliver anywhere near the amount of therapeutic vibrations, and because they drive the head and the muscle, they can easily do a lot of damage. Now, people have nearly died from internal bleeding after using them. Now, I'll link how to choose the right machine, but I don't want you hurting yourself, so I'll quickly show you the difference. Now, looking at this diagram, the machine on the left is a genuine vibration massager. Now you see it has a large contact pad that sends in large amounts of vibration. Now the tool on the right is a T-bar, which massage therapists use to apply deep, painful pressure. Now massage guns are basically T-bars with the jackhammer mechanism to help drive the head in. Now you can see that the massage gun delivers a lot less of the therapeutic vibrations, which means they're not going to have the effect on the trigger points, while driving the head in like a jackhammer can do a lot of damage. Now, especially if you get things like nerves and blood vessels. Now, massage gun marketers are very misleading. Now, they'll tell you that the vibrations have excellent benefits, but they won't tell you that they deliver a lot less of those than a proper machine. Now, they'll also tell you that driving the head in increases penetration, but it's the vibrations that do all the works, and they go in much deeper. All driving the head in does is potentially hurt you. Now next we'll look how to set your machine up. Now therapeutic vibration ranges from 30 to 60 Hz, which is cycles per second. Now I like to use about 50. Now that's really comfortable and seems to get the best effects. Now a lot of machines get their speed in per minute, so 50 Hz is 3000 RPM. Now if you use one of our general purpose massages, their top speed is about 60 Hz, so what I do is back it off about 10%. Now if your machine has different heads, just remember it's the vibrations that do the work, and driving the head in the muscle could potentially hurt you. Now with my machine I use the flat head most of the time because I'm most comfortable and sends in the most vibrations. Now we've got a smaller head, but that's not for extra penetration. It's to access parts that the flat head can't get to, like say inside the arch of my foot. Now, to get good lasting results, if you've ever had trigger point therapy before, you'll know you can have courses of needles, lasers or massage type trigger point therapy and feel good for a while, but the pain eventually comes back. Now that's because trigger points have usually been there for a fair while and can be very stubborn. Now the treatment stops them hurting, but doesn't get rid of them. Now what you need to do is keep working on them after they've stopped hurting. Now do that until you can't feel them anymore when you examine them or the machine runs over them, then maybe once a month just to keep them at bay. Now that's very easy if you've got your own machine, so you're not making appointments and paying out all the time. Now one last bit of general advice I'll give you is that trigger points are often part of more complex musculoskeletal problems. Now you can do this therapy yourself, but if any doubts or the problem keeps reoccurring, don't hesitate to get some advice from a professional who deals with these sort of problems, such as chiro, osteo or physio. Now with that, let's show you how to find all the trigger points in your upper back. Now the main muscle for the upper back is the trapezius muscle, which is divided into three main parts. Now, in these diagrams, the X shows where the common trigger points are and the red where they refer pain to. Now there's about 10 other muscles in the region too that help work your shoulders and spine. I don't think you need an anatomy lesson though. Now, all the muscles are right across here and around the back, so as long as you go over the right area, the massager doesn't care what their name is and the vibrations will penetrate and find them. Now the best advice I can give you is to show you how to systematically go over them all. Now starting with the ones at the top of your shoulders and up the side of your neck, they're pretty easy. Now the main trick is that when you lift the massager, it tightens your shoulder muscles, and if you remember, we want them relaxed, so what we do is hold the massager with the opposite hand. Now to make the massager easy to hold and so gravity works for you, you can lean forward and a bit to the opposite side. Now if you've got a massager with a decent handle, it's very easy, but if you have something like a massage gun, you'd almost need to be Inspector Gadget. Now go over the muscles systematically, starting at the tip of the shoulder and working across the top. Now if you feel around the side of your neck, you'll go around the back and you'll feel it'll be a nice thick muscle. But you start heading around the front, you'll get to the part where it won't feel nice when you press in. Now that's where there's nerves and blood vessels and spiky bits at the side of the spine. Now you stay away from them. Now if you like, you can go over the muscles systematically, spending 30 to 60 seconds in each spot, or you can slowly move the machine along and stop for 30 to 60 seconds if you feel a possible trigger point underneath. Now the next area we'll look at is around our back a bit lower. Now to use gravity to help, you can lay face down, but I find it really easy just to lean forward a bit like this, supporting the weight with my elbow on my knee. Now you need to make sure the head of the machine is sitting flat, and there's a fair area to do, so you need to be systematic. Now the best way though is with one of our quad heads. Now they sit nice and flat and do a big area at once. Now, the other main area is around the back of your shoulder blade. Now, I find the easiest way to do this is to lay on my side and roll forward a bit to get the area more horizontal, and have my arm up like this so you can easily get at the muscles. So, there are the muscles. I'm sure that after doing it a few times you can work out a routine, so it'll be fast and easy. Now, the last thing I mentioned about the upper back muscles is prevention. Now, as I said, things like sitting at a desk can cause trigger points to develop in your upper back muscles. Now that's because the muscles tend to be constantly tight, pressing on the blood vessels, restricting blood flow. Now I'll link an article on how to prevent that. Now lastly, as I said, you need a genuine vibration massager. Now a lot of the vibrating massagers are not serious therapeutic devices, and as I said, massage guns don't deliver the proper therapeutic vibrations. Now that said, genuine vibration massages are not that common, and most are designed for professionals like myself to use on patients rather than for self-use. Now I'll picture a couple of examples here. Now because of that, we built our own personal use vibration massagers. Now this is our general purpose massager. Now the business end delivers copious amounts of therapeutic vibration. It's got a proper ergonomically designed handle so you can easily use it anywhere on your body, and has very easy to use controls. Now the on and off switch is underneath and has a sliding variable speed control on your thumb. Now, over the years we've sold over 100,000 of these without any advertising, mainly through professionals like chiropractors, osteopaths and physiotherapists using them and recommending them to their patients. Now, more recently we've developed our quad-head machine that has all the good things the general purpose massager has, but can do a much greater at once. And because the front part is larger and flatter, you can easily use it like a cushion or chair massager. Now, for more information on using vibration massagers or our machines, please see our website or the description. Now, if you have any questions or comments, please don't hesitate, and thanks very much for watching. It's been most appreciated.